Today I'm presenting my student Zhen Xu's work on non-invasive thrombolysis using microtripsy. Here we go. So histotripsy has been investigated before to show that it can be used to break down blood clots via cavitation alone. So non-invasive, no drugs, and no contrast agents involved. And the ultrasound image is used to guide the treatment in real time. So when we initially started, we were using shock scattering mechanism. So what it is, we use 3 to 10 cycle pulses. And the cavitation is generated by the scattering of the high amplitude shock wave from the initial sparse individual bubbles, then form this large amplitude negative pressure and form a cavitation cloud. So using the shock scattering mechanism, the issue is you have weak nuclei resides on the vessel wall and the blood interface. So you tend to form the cavitation actually on the vessel wall. So there's a concern that we may actually damage the vessel wall, particularly the valve function. So we started investigating using intrinsic threshold mechanism for thrombolysis. So intrinsic threshold mechanism, we use one cycle pulse, so a single cycle ultrasound pulse. So that removes the shock scattering possibility. And using the one cycle pulse, the cavitation is generated by using the peak negative pressure directly exceeding a threshold that's intrinsic to the target media. And that's about 27 megapascal for the blood clots. And we call this a new histotripsy approach microtripsy. So using the microtripsy approach, the cavitation actually can be confined within the vessel lumen because it does not depend on the weak nuclei on the vessel wall. So we hypothesize that microtripsy can generate and confine cavitation in the vessel lumen during the thrombolysis treatment, resulting in precise recanalization through the clot and the minimal vessel damage. And this is actually the first microtripsy study that we conduct in vivo using the deep vein thrombosis porcine model. All right. So we actually use 14 pigs. So we insert a catheter and form the clots with basically occlusion of section of the vessel with thrombin. And 10 pigs were euthanized after 6 hours after the treatment on the same day, and 4 pigs were survived for 2 weeks. The acoustic parameter used were one cycle pulses using 1 MHz transducer with 1,000 pulses per focus. And the treatment speed is about 16 minutes per centimeter long clot, and that speed actually can be upped if we use a higher PRF. At this point, the duty cycle is still really low, 0.01%. So the heating is pretty much non-existent at this point. And we did a 2-pass full treatment, so just to actually mechanically scanning, just to enlarge the treatment zone to get a bigger flow channel. So for the cavitation, this is actually an ultrasound movie. Can we start the video, please? So this is a video showing, ultrasound video showing the cavitation actually during the treatment in real time in the femoral vein. So when you zoom in, you see it a little better. It's this dynamic bright zone within this dark circle. And you can see we're confined, and also in this vertical line you see, that stable vertical line is a therapy pulse. So we synchronize the imaging with the therapy so that it does not interfere with actually the imaging monitoring. So we actually look at ultrasound image, both the B mode and the Doppler, and you can see that before the treatment, the B mode, both B mode and Doppler showing, in this case, the clot actually is completely occlusive, no blood flow. Right after treatment, you see a nice blood flow restoration through the vessel. And 2 weeks after, the blood flow remain patent. And we use the same scale for Doppler. So you see the blood flow, and actually there is an increase of the blood flow rate, and that's why you see the color change because of the aliencing. This is a summary of the clots and showing that in 14 cases, we had 13 out of 14 cases where we have seen the blood flow improvement or restoration. In one case that didn't see that, and we actually had some technical difficulty with a catheter insertion of the clot formation. And in the occlusive case, we created a flow channel through the clot of 3.6 millimeter, and the femoral vein diameter is 6 millimeters. So that's 56% of the opening. The vessel damage quickly showing, so this is 2 weeks after, we see a mild thickening of the median layer of the vessel wall of some inflammatory cells. And other than that, there's no significant abnormalities. So the femoral arteries and the surrounding tissue looks normal. The intima, there's no damage. The valve is preserved. So we also check the lung sectioning for any potential emboli and infarct, and nothing was found. So the conclusion, the cavitation was well confined in the vein lumen during all the microtripsy treatment. Flow was restored, and we checked the hemolysis, and there's no severe hemolysis. In one of the acute treatment, we see a minor hemorrhage outside the treatment vein, but other than that, no abnormalities. And I want to thank the Histotripsy Lab, all the collaborators, and our funding resources. Thank you.
That's a nice presentation.
Thank you,
It's
Vera.
always the question, and maybe you have some control. Can you somehow watch whether there's any big pieces of this clot thrown away by this treatment?
Yeah, so that was a big concern even at the right beginning of this research. So the interesting thing we found out is that, which I didn't show, we actually did some some extensive study of looking at the flow pattern we generated. So it turned out when you generate cavitation in the flow, because of boundary effect, it actually creates this vortex flow where the pieces, even you have fragments, it captures in the flow until it's fractionated, then release until it's actually going to very tiny debris. And we also have done a study, this study we look at the lung section, because in the femoral vein, if you have emboli, you should go to the lung. So that's why we look at the lung section and didn't see any evidence of the emboli or infarct damage caused by the emboli. In other study, we have actually done in the heart and trying to look at the brain, and the same thing, we didn't see any evidence of the emboli. And I think it's related to the cavitation-induced flow trapping any pieces of the clot until it's completely fractionated.